So good afternoon, everyone. Thank you so much for the awesome presentations over the for the past couple of days. The bar is really set high, no pressure. So my name is Chase Sims, and I completed my practicum in Toronto at a nonprofit health promotion organization called Health Nexus. And they support individuals, organizations, and communities that strengthen their capacity to promote health. So my actual project entailed two things. So the first one was to conduct a literature review on increasing organizational capacity for health equity work. And the second part of this was actually creating an evidence brief that was tailored to the specific needs of Health Nexus. So first, I'm going to go over the background information of the literature review specifically. I'm not going to be talking about the evidence brief in this presentation. And then following this, I'll be going over some methodology, results, discussion, and then some concluding remarks. So the literature review actually builds upon the health equity strategy that Health Nexus developed this past year. And I'm going to try this laser pointer. There we go. Perfect. So the actual goal here of the strategy is to strengthen Health Nexus's capacity to develop healthy, equitable communities. And there's three objectives that were part of this health equity strategy. So one of the proposed action to support objective 2 here entailed actually conducting the literature review and the evidence brief, which is why I was called in to help. So when I initially went to Health Nexus, I held some informal conversations with our health promotion team. And I was really trying to gauge what they really specifically wanted from this, because it's quite a broad topic. And what was echoed was, what can I do to increase my health equity capacity in my work day to day? So here are the two purposes of the literature review. So the first one is actually developing a framework that health promotion organizations can use to increase their health equity capacity. So for example, if an organization were to develop a health equity strategy of their own, they could use this framework to actually provide some direction for that. And this leads into the second purpose, right here, which is to provide detailed health equity actions as well that they can effectively adopt and use. So now we're going to be going into the methodology. I'm sure you guys can tell I am a big fan of PowerPoint transitions. So for the first part, there's multiple databases that were used for this. For example, Web of Science, Google Scholar, and Health Evidence. And the majority of the information was actually found in the gray literature. And it was done by organizations such as the National Collaborating Center of Determinants of Health. So the evidence was appraised, down here, using things such as the credibility, reliability, authority, quality test. And that was used for gray literature screening of briefs, reports, and resources. And in addition, a lot of website evaluation had to take place as well, using the currency, reliability, authority, purpose tests, also lovingly known as the CRAP test. So in the table above here, you will see the inclusion and exclusion criteria produced. So like I was saying earlier, it was really narrow to actually narrow down the specific parameters for this, because health equity is such a broad topic and it does span over various sectors as well. So for this, primary and secondary literature were included. So this was things such as conference proceedings, systematic reviews, and practice guidelines. And whereas tertiary literature was excluded from this, and that would be things such as textbooks and encyclopedias. So now we will go over to the results section, and this actually overlaps with a lot of the themes that have been outlined so far in other presentations, which is good news. I'm not too far off. So initially, the information from the 46 articles was broadly categorized, and this was followed by some thorough evidence synthesis that took place, which was tracked in an evidence tool actually created by Health Nexus. So I was kind of piloting that at the same time because it hadn't been fully utilized before this. And this produced 5 key themes that you can see here. And that work works towards increasing health equity work within these public health or health promotion organizations. And if the themes were discussed in less of 10 articles, they were excluded from this framework. So, this is the framework that was developed on the 5 themes detailed in the findings that I just showed. And this framework was created as a tool to actually embed equity into organizational capacity. And as you can see, the core foundation is strong and effective leadership, since it was present in over half of the articles. So distinct best practices were found throughout all the 5 themes here. And it boiled down to integrating evaluation and reporting to increase accountability. So common descriptions in the article included establishing and using performance measurements, evaluation, and health equity indicators, and ensuring the clear accountability measures are built into accountability agreements. So this could be things such as including explicit deliverables. In addition to this, there is integrating the concept of health equity into program plans, work plans, organizational strategies, and reports also. And then lastly, it's really important to provide these and support opportunities for staff to actually share their health equity experiences with others, for example, at staff meetings. And lastly, acknowledging those who actually promote health equity work. So in the actual literature review, I outlined the implications, barriers, and actions for each of these themes, but we don't have an hour, so I'm just going to briefly go over the actions of these themes. So as noted before, the core foundation, strong and effective leadership. Key actions include establishing performance measurements, creating a clear organizational mandate. The second tier includes things such as fostering theoretical and methodological innovations. So this could be in knowledge generation, knowledge synthesis, knowledge integration for population and public health also. And there's numerous contributing factors. For example, having a lot more web-based determinants of health and health equity portals. So the third theme here, collaborating and partnering with stakeholders and communities. So this can include actions such as developing working groups, as well as ensuring comprehensive strategies and strategic directions are actually in place. The fourth theme, demonstrating and increasing competencies, include things such as professional and cultural competencies in particular, and ongoing training within a supportive work environment. Lastly, it's embedding equity into their mandate policies and procedures, and this would foster an enabling infrastructure for staff to work within. Finally, I'll provide some concluding remarks. I'll try to keep this short and sweet. I know we're all itching to get out of here. Some of us had to catch ferries. So health equity takes time to fully implement and integrate within an organization. The sheer amount of information may be very daunting for organizations and practitioners to actually implement. So although this health equity work is very urgent, it's crucial that these organizations considered a phased implementation approach of these health equity activities. So in this way, staff and organizations as a whole don't feel overwhelmed that they have to complete this all at once. The evidence clearly articulates that effective health equity works begins with leadership that is strong and effective. And again, beginning with this core foundation could serve as an ideal first step for organizations to adopt in their pursuit to increase their capacity to strengthen meaningful health equity work. So I would like to especially thank my practicum supervisor, Andrea Botkin, and our executive director, Barbara Willett, who gave me this opportunity. There's a lot of organizational changes that were going on in the past 4 months, so I really appreciate their time and their patience, and the baked goods that constantly were provided as well. It was nice. And I'd also like to thank Kathy, Sari, Nate for giving me constant and valuable feedback, and the rest of the school and my peers, obviously. We're all in this together. We're almost at the end. I can feel it. And that is the last tacky transition. Are there any questions or comments?
Okay, questions for Chase. That looks like a hand back there.
Hi, Chase. Thank you for your presentation. Just wanted to ask about your framework. Do you think this would be applicable to other organizations, in your view, outside of health equity and health promotion?
Definitely. So I think since the scope of this was specific to health promotion organization, it is quite broad, as you can see. So if there's other organizations related to public health specifically that would want to adopt this in their pursuit to increase health equity work, I think that would be a good strategy. And even non-health organizations that want to try and integrate that into their mandates, their policies, procedures to really get at the root causes of that. So everything they do has that equity kind of embedded within it.
Thank you.
Yeah.
Other questions? Lynn? Wow, that was easy.
I just have a comment. That is the best cartoon about best practices I've ever seen.
I'm glad you enjoyed it.
Well, I guess if nobody else has a question, I have to ask the question, and maybe it's an obvious, the converse of these, but so tell us about the barriers.
Oh, the barriers. I think a lot of people have touched upon it already. I think the biggest ones that are fairly obvious are time and resources. A lot of this, like with health promotion organizations, nonprofits, they always struggle with funding. It's like a year to year, always fighting tooth and nail just to ensure that your staff actually has a job next year. So when you're trying to worry about job security, the last thing you're really thinking about, how can we help marginalized groups when I could potentially be a marginalized person in a year when I don't have a job too? Like, it's just really hard, and that's barriers kind of weighted on you all that time as well.
Any other questions? If not, thank you so much, Chase.
Thanks.
And we will invite Rebecca up.